We got pregnant the second time last fall, and everything was going good. And I got sick right after Easter, like sometime around April. My son and I both had bronchitis, I had upper respiratory infection. I was coughing and stuff, so one day it hurt when I would cough. It would hurt when I would breathe. And I guess when you're 7 months pregnant and you call the doctor and say, it hurts when I breathe, they said, go to the ER.
Her blood pressure was very low, so I was called in as a cardiologist to consult on her case and to stabilize her blood pressure. And we were concerned about the health of Rebecca as well as the health of her baby.
We weren't really sure what was going on, but it wasn't normal for a pregnant woman to be having persistent symptomatology. We were pretty sure that there was something growing in her chest that wasn't supposed to be there.
He comes back in the room and says, well, you don't have pneumonia. And we were like literally about to get up and leave. He's like, but you have something else.
She had fluid around her heart, and she had an extremely large mass filling the middle of her chest.
When the biopsy came back is when Dr. Falk came in and said, yeah, it's lymphoma. He just seemed like he had known that. And I think now they were just narrowing it down to what type of lymphoma. And I said, well, if I stay here at Wakelands Hospital, you're going to treat me, or are you going to take care of me? And he said to me, I am going to take care of you, and I'm going to gather a team of people that are going to take care of you, and you're going to be fine. I remember saying to my husband, I could go to the city, but I could stay here, and it was a choice between being like, a big fish in a small pond or a small fish in a big pond, and I wanted to be where I trusted them and I knew them, and so we decided to stay, and then they admitted me to White Plains Hospital.
The whole thing about a cancer diagnosis is that you don't just need the cancer doctors. You need the entire medical team to be working with you.
One of the things that is unique about our hospital, almost every patient that is diagnosed with cancer is discussed at a multidisciplinary conference with all of our providers in one place. One patient mentioned that it's like getting 17 second opinions.
So many people that Dr. Falk pulled in for what I kind of call my cancer team. They weren't sure if they were going to do some radiation at first.
We had a consensus of physicians, radiation oncologists, medical oncologists, pathologists, surgeons.
Una Hawkins, who's from Dickstein, she became very involved in my case, helping me understand what the different things were.
The key thing was to come up with a treatment regimen where there was this consensus agreement that would be safe for the patient, effective for the patient, and safe for the baby.
So they ended up deciding I would do the standard R-CHOP chemo, and they would wait on the Rituxan part till after the baby was born.
So some drugs we couldn't use, but other drugs we could use and give it in a safe manner.
We got an 86% tumor reduction, and Dr. Falk is like lurking around the hallways of radiology. Everybody's waiting. It was off my heart, so Dr. Capucci was comfortable. So now we were ready to talk about the baby. At this point, I also knew all the labor and delivery staff. They had to come do a non-stress test on the baby every day.
As labor and delivery room nurses, we got the opportunity to give Rebecca the feedback that she needed on a daily basis about how her baby was doing through all of this chemotherapy.
Dr. Lupin felt comfortable at 35 weeks. He had Dr. Haley come meet me from the NICU, he was amazing, and his whole team.
She had tolerated the chemotherapy very well. The fetus reached the expected parameters based on sonography.
She was able to experience the whole thing. The labor went smoothly. The baby came out crying, and it was really a very, very uplifting experience to go through.
It's always amazing to deliver a baby, but this baby felt like we had worked so hard for it, and everybody had worked so hard for it.
It sort of hits you when you see that what you've done was a positive thing.
When I walked into the NICU and I saw Rebecca holding her beautiful baby, it was just a wonderful feeling, a moment where you really see the beauty of life and what we can do to help that moment come to fruition.
In all the years I've known Dr. Falk, every time somebody's pregnant, he asks, are you going to name the baby, Mark? Are you going to name the baby? Nobody ever does. And, throughout the pregnancy, I let my husband pick the baby's name, but the baby did not have a middle name. And I said to my husband at one point, I think we should name him Mark.
When I went up and visited her in her room, and Grandma hugged me, and everyone hugged me and let me know. An emotional moment.
She basically said, I wanted to name the baby Jay, but Mark is the middle name that I chose instead. But she has assured me subsequently that with the next baby, Jay's going to be in the equation.
Just a few years ago, Rebecca might have been transferred to New York City for this type of care. That is no longer the case, and is an excellent example of how we are redefining community health care and community cancer care.
The White Plains Hospital Cancer Program is a Commission on Cancer accredited program. More importantly, during our last survey, which was 2012, we achieved an Outstanding Achievement Award. To put it in perspective, there are 1,500 programs throughout the country, and we're one of 79 to achieve this distinction.
So a significant portion of our community will at some point in their lives experience cancer, and we have to be there to provide care for them.
We've tried to continue to enhance the program by recruiting excellent physicians who are excellent in their specialty.
Over the past 2 or 3 years, we've attracted both surgeons as well as oncology physicians that are bringing more complex care at this community level.
I thought that the team of doctors in White Plains Hospital was really amazing. That's where I brought my own family members to be treated.
The cancer care at White Plains Hospital is exceptional. The new OR incorporates all of the latest technology and allows surgeons to provide the highest quality care to the patients.
People don't realize that we do as many, if not more, cancer surgeries for prostate cancer, kidney cancer, ovarian cancer, uterine cancer, colon cancer, thyroid cancer, and I could go on, than some of the leading facilities in New York City and the surrounding counties.
You might think that a community cancer program can't have a vibrant research program, but as it turns out, 4 years ago we had one open research trial. We now have 18 trials. We now have over 190 patients on clinical trials.
Back in 1999, we built the Dick Steen Treatment Center. Today, that facility is way undersized for the program that has developed here. We are so excited, and we are planning on doubling the size of that cancer facility.
And that's going to mean that when a patient comes through the doors and a diagnosis of cancer has been made, everybody that needs to be involved and will be involved in the care of the patient is already here.
When you enter a building or any organization, you can tell. You don't have to be there long to figure out if this is a place that's well run, where people are happy. It's a special place, and it's definitely essential to our city and our region, and I think that money invested there is money well spent.
You always wonder if you mean as much to these doctors as they mean to you.
Everybody did for you, and we appreciate what you did for us.
It became like more than just like a job to them. They wanted to help me, and they were emotionally connected. But I also don't think that at White Plains Hospital they would be treating other patients any different. Oh, yeah, big fast, huh? How are you?
It does get very emotional. We have good stories, we have happy stories, happy endings. Rebecca could be my daughter-in-law. Could have been that she was pregnant with my grandson.
The bond that I'll have with the baby will always be different than any bond that I'll ever have with anybody else. And I did feel like we were a team. I wasn't alone. He was there with me, and I could feel him, and we were, together. And I will feel like people went above and beyond, not just for me, but for him.
Well, Rebecca came in 2 weeks ago for her last chemotherapy. And it was really hard because we knew it was her last chemotherapy, and we had had success. Success at shrinking this very large tumor that we found in that emergency room. 2 gone, dissolved. And it was the work that we had done to get her there. And she came in and she presented me with a gift. The gift was a beautiful picture of her hand and her son's hand, and told me I was her inspiration. It wasn't her inspiration, she was mine.
I feel Rebecca is a part of our life forever.
How are you? I don't really know how to say how I feel to these people for what they did for us.
I can't be thankful enough. I mean, they saved my wife. She's my soulmate, and I don't know how I'd go on without her.
But you can hang out with me all night, my mom.
Yes, you too.
I don't know. I don't feel like words are really enough to say to everybody, what they've done for us. But I think that the people who have been through this with us know how I feel about them. But I will always remember them, and I will always be grateful to them. And I will always, have a place in my heart